Over the last 25 years, I've been working as a physiotherapist and I've been treating people with sciatica on a virtual daily basis. So what have I learned about all those years and all those patients that I've seen? This is the subject of this video, and you may find things in this video that actually are reassuring to you and make you feel better and more optimistic about the situation you're in. So the first thing I've learned over these many years and many patients is that every person is unique. So they have their own unique physiology, their own unique anatomy, and particularly their own unique psychology. And so even if somebody presents with the same pain, i.e. sciatic pain that goes down the leg from the lower back, the causes of it and the solutions of it can often be very different depending on the needs of that unique individual. And this is why certain exercises can be really good for some people and the same exercises can be not so good for other people, because it depends on getting that correct recipe right for that particular unique individual. Now, there are generalized patterns, and this is the next thing I've learned. Patterns tell us where things are similar between individuals, between those unique individuals, where we can make a little recipe of how things often get better. Now, we might need to tweak them a little bit, but generally speaking, our pattern for that particular person can help us decide what is the best course of treatment for that person. So, for example, if somebody has pain when they just bend forwards and that radiates down their leg, that is different to somebody who gets pain radiating down their leg when they're walking along or upright. Now, both of them could be described as sciatica, but the solutions for both are quite different. They both involve getting moving, but they are different in terms of the movements and the exercises that we might prescribe. Now, there is a sequence of events that has to take place for successful treatment. The first priority is to reduce pain if possible. So by reducing pain, we're going to reduce muscle tension and therefore be able to move into being able to move. And then from modified movement, certain movements, we move into general movement and strengthening. Now, I see a lot of the time that people try to prescribe, say, core exercises like the plank, for example, to somebody who's in a lot of pain with sciatica. Now, the difficulty with that is that pain inhibits muscle function, which basically means that you can be banging your head against a brick wall and not getting anywhere because your muscles won't work because they're in so much pain and there is spasm there. So it makes sense to first of all set a priority of reducing that pain first before we then re-establish strength and control. So the ways that we can try to reduce pain are things like finding comfortable positions to let the pain settle down, taking medications that help to take the edge off pain, and simply by modifying other behaviors and stopping aggravating behaviors as much as possible. And so by getting that as a priority to begin with, our sequence then goes where we can start to do other exercises which are modified movements until we finally can do full movements and greater ranges. Now, this relates to another thing that I noticed really, treating people for all those years, is that it's always a try, evaluate, modify sequence. So we might try a specific exercise, we might evaluate to see if it increases or decreases leg symptoms, and then we might modify that exercise to even get rid of it completely or possibly to modify the way that we're doing it so that it doesn't produce those pains and is therefore beneficial. So that sequence of events, we try it, we evaluate, we modify, and those things help us to then progress treatment and get that person from a situation where they're in a lot of pain to being able to move to having no pain at all. Now, what I've seen over these years is that 98% of people with sciatica get better, really completely better. But the difference can be how quickly they get better. And that largely depends on the particular course of action they take in terms of self-treatment and rehabilitation and guidance from people like me. Is that if we get it right, then often people get better much quicker. And if people try to do it in the wrong way, they often have a more prolonged period of recovery. However, in both instances, the end result is that they do get better. So let that be an encouragement to you. Now, the final thing I want to mention on this video is the significant impact of stress on symptoms. I've seen this time and time again where if you have stressful situations or emotional situations, then that can increase the sensitivity of the nerve system and that can increase the experience of pain. People can go down psychological rabbit holes where basically they are in a lot of pain and distress, which then means they tense up and then they are fearful and then they avoid movement and they are more fearful, and so the sequence goes on whereby they actually move less and the sensitivity of their pain actually increases. And that's not a good situation to be in, because when sensitivity increases, the threshold upon which we feel pain reduces, which means simple touch can be producing pain as an experience for ourselves, even if it's nowhere near in terms of damaging a problem. So we get this chronic pain cycle, and stress makes a huge difference on regulating that. So that's why things like meditation and mindset changes, in combination with getting the right recipe of exercises, is the solution. And this is particularly relevant to people who've had sciatic problems for an awful long time, suffering it for, say, more than 3 months to sometimes years, is that there's more than likely a massive overlap of psychology and stress response on top of that. Now, that is fixable. You can overcome it. And the complexity of trying to deal with that is far, far greater than a simple physiological exercise regime, which tends to be effective for someone who's had sciatica for a much shorter period of time. If there's any questions that you have about your particular type of sciatica experience, I'd be happy to try and answer those and make further videos about them. So please do write in the comments, and if this has been useful to you, then please like the video and maybe subscribe.